This conference will now be recorded.
Hey everybody, this is Jennifer Harris with the Florida Department of Health in St. Lucie County and with Healthy St. Lucie, and we're so happy to be here today for another episode of The Art of Healthy Living. These webinars are brought to us by Primary Care Associates and Humana, and we're so excited to be partnering with them this fall on these series of really important health topics for our community, and we're so happy to be partnering. Thank you so much for that. So Healthy St. Lucie, what is that? If you're new today, it's a coalition of about 35 different community organizations, as well as community members and other stakeholders promoting health where we live, learn, work, and play. And this organization got started back in about 2016 as the result of another community health assessment that we did, looking at where are the areas in St. Lucie County where we can improve some health in the coming years. So they developed a community health improvement plan, which I have on your screen right now. I am live with the screen, right, Emily? Good, awesome. So we, as you can see on this sheet, we've got about 3 major focus areas for other, themes of our community health improvement plan right now. We're trying to get people to eat more healthy, getting people to move more, and getting people to feel better by either managing their chronic disease better or preventing that chronic disease altogether. So you can see on the screen, we have a lot of different initiatives going on, like breastfeeding. We've got eating healthy focuses in schools, work sites, and in the community area as well. We do have a food council looking at our food deserts in our community and how we can manage those better. And then for moving more, we've got our Billion Steps Challenge, which is getting people to work more on getting more movement during the day. We use an online platform called Walker Tracker to track those steps. And each year we're working as a community to get 1 billion steps by the end of the year. We've already gotten over our 1 billion steps this year, heading into December, which I'm so excited about. And we've got some really exciting ways that we're going to start working with work sites in the coming year to get more traction in those work sites and getting some fun teams going next year. So we're really excited about that. And then feeling better, we've had a diabetes support group that's been a little hard with COVID, having that face-to-face meeting, but we're really looking and building up and out our diabetes prevention and self-management pieces with the community in the coming year. So we're really excited about the traction and movement we have there. Also, we have our tobacco prevention and cessation program here. Today is the Great American Smokeout. So we encourage anybody that is thinking about making a quit attempt to do that and share some information about Tobacco Free Florida's services. We have free nicotine replacement, a lot of other prescription medications that we can talk to you about as well. And you can quit your way with Tobacco Free Florida. And then we're also working on an age-friendly collaborative and looking at how in St. Lucie County do we want to age from birth on, and looking at how we want to stay healthy and as chronic disease-free as we can. So that's where we are right now, and we're working on a brand new community health improvement plan right now that'll build on where we've been here. Also looking at some of the social determinants of health that we have in our community, and we're really excited about that. We're in heavy planning mode right now with steering committee meetings happening, but it's never too late to join. That plan is one of those plans that doesn't just stay on the shelf. We keep making changes to that and adding as we need to move forward. So if you're interested in participating in that process, just shoot me an email. Would love to have you on board with that. So this November is National Diabetes Awareness Month. Every November, approximately 88 million American adults, that's 1 in 3, have prediabetes. However, of those that do have prediabetes, more than 84% don't know they have it. That's very alarming. But the good news is that if you do have prediabetes, there are a lot of lifestyle changes you can make to prevent and even delay developing type 2 diabetes. So we're super excited to have Dr. Sadik Bizanti here today with Primary Care Associates. He's going to do our presentation on preventing diabetes, and it's very timely. So I am going to turn it over to Dr. Bizanti and let him take it away.
Thank you very, very much, Jennifer. That's really, I think, very highly appreciated. Love helping the community as always. Primary care, we thrive to do that in our community and how to make sure patients are indicated with all what's going on. A little bit about myself. I've been working with population health care management programs, more in trying to keep patients happy, healthy at home and out of the hospital. We call it the 4H. And we try to make sure that the patients, are well educated with how can we utilize reduction in utilization, ER visits and hospitalizations. And today actually is a very, very important topic. And diabetes is one of the most common chronic conditions that, as you just mentioned with the numbers earlier, it's very high epidemiology here in the United States. So yeah, let's get to it. Awesome. So a little bit, this is like what is it called? Reminders before the class, please. If you have, it's going to be a 30-minute session. Ask any questions in the middle if you have anything. If you have any cell phones, or everyone's unmuted and that kind of question. But if you do have a question, we love participations. There's a chat button in there. Throw in your question. We'll see it right away. We'll get on top of it. We'll even put some links out there if you want during the session. And if you have any questions, just unmute yourself. I love to hear you guys' feedback. All right. Yes, next please. So today we're going to talk about mainly, it's a very common and very serious condition, diabetes. And this is the month of prevention of diabetes, November, as she mentioned. CDC actually, how they define diabetes is very, very, they define it by, it's a condition where the body does not properly process food for use as energy. So during today's class, we're going to mainly talk about 3 different topics: the basic of diabetes and prediabetes, factors that increase your likelihood of developing the diabetes, and steps for preventing diabetes. So what are we going to do in steps in terms of healthy eating, physical activity, and weight management? And all this is actually brought by, the sources are CDC usually. Yeah. The next. So let's start. So for those who, just to give you a general idea of what is diabetes. So CDC defines it again as the body can't use those energy, can't process the food for use as energy. So let's talk a little bit about what happens. The majority of the food that you eat is broken down into glucose, which is kind of like a fancy name of sugar. And what it does is for the body to use it as energy. This glucose is the body's main energy source to like gas, like the gas for your car. Like when you fill out that same thing, energy for the car, but this is for our body. Now, during digestion, glucose begins to pass the bloodstream. Insulin, which is a hormone that's produced by the pancreas, that breaks down that glucose to get into cells, and this prevents glucose from building up in your blood. And that's the whole idea of insulin, to not make it high in blood. In people with diabetes, the body either doesn't produce enough insulin, or it doesn't use the insulin it has as it should be. This means that the body cells cannot let the glucose in, so the glucose builds up in the blood and it's causing high blood sugar. And those are the 2 types of diabetes. Either insulin is not produced enough, and that's in type 1, or there is insulin, but it really doesn't work, and that's type 2. And we'll go into it in the next slide. So in this slide, we talk about what are the types of diabetes, right? So we hear there's actually 2 main types, and there's another type. They recently, American Diabetes Association recently added this as a pre-diabetic type. And this is what we're going to mainly talk about and how to prevent that stage. So the 2 main types are, according to CDC, is type 1 and type 2. Type 1, it's usually an autoimmune disease. It's usually a genetic disease. And and there's a lot of environmental factors. And another thing, it usually happens in young age. So usually people get it, early teens or maybe even before that. And they're usually thin, and there's like features of type 1 diabetes. But they're dependent on insulin because the pancreas does not produce enough insulin. There's a problem with the insulin producing cell, and that's where type 1 is. So there's a buildup of sugar in your bloodstream, but someone with type 1 diabetes diabetes will need to take insulin dose daily in order to compensate for that inability of the pancreas to produce enough insulin to break those glucose. All right, so that's the type 1. Type 2, on the other hand, is called insulin resistant diabetes, which means that the pancreas already produced that insulin. There is insulin in a sufficient amount, but the body cannot utilize that insulin. So it accounts for a majority of all cases actually in type 2 diabetes. The pancreas still makes insulin, but it doesn't do its job. It's kind of like you're hiring someone, but they don't do their job. That's what insulin here is kind of doing. Glucose just hangs around and it builds up in the blood. The pancreas makes even more insulin to try to get rid of that glucose, but the problem is where the insulin should work, it doesn't, and therefore there's increase in glucose in your blood. Yeah, so that's the type 2 diabetes. And type 2 diabetes, mainly we use different type of medication like metformin, and we'll talk about other medications. However, the third type, which is what our main focus is on today, is called prediabetes. So prediabetes is when a person's blood sugar level is higher than normal, but not high enough to constitute as a diabetic, to be diagnosed as diabetes. And there's a cutoff line where American Diabetes Association show, and we'll talk about that in the next slide, on what are those numbers cutoff line that, you know, would call a patient either a diabetic or not diabetic. So if you're below that cutoff line and above the normal, then there's a range there where we call it pre-diabetic, and this puts the person at a greater risk of developing diabetes in the future. And today we're going to talk about how to prevent that, how to keep that in control, how to get that back to normal, and what are the different ways. And this is the best I like about this. Yeah, so let's go next. Awesome. So here, based on the National Institute of Diabetes, you know, and the American Diabetes Association, digestive kidney disease, like there's a lot of guidelines. This is what they summarized it here, and this is the best of the best. They came up with this table. So according to CDC, their type 1 diabetes is, so according to American Diabetes Association here, they categorized hemoglobin A1C, which is the first column on the left. Hemoglobin A1C, what's the percent of hemoglobin A1C? By the way, hemoglobin A1C is a blood test that we do to measure your blood glucose in the last 3 months. So it shows us what's the average of your blood glucose in the last 3 months. So if I want to get a picture of that, I do one test and it shows me right then and there. So that cutoff line is 6.5 or above, they diagnose it as diabetes. If it's 5.7 to 6.4, that's the pre-diabetic, and we want patients to be below that. Around 5 is what we're aiming for, to be within a normal, considering as a normal. So it's important for you to know that hemoglobin A1C test is frequently used for those who have already received a diagnosis of diabetes. This helps determine how well that blood sugar is being controlled, you know, as we said, in the last 3 months. Now we look at the next one, the fasting plasma glucose, the next column there. We define that as what's happening during the last day. So we bring the patient in, they're fasting, we take their blood glucose, and fasting, we require them to be 8 hours of not having any, you know, food in their body to get this result. Now, the numbers they categorize it as, American Diabetes said if you have 2 of 126 or above, you know, that's how they diagnose it. You have to have 2 or more of these results to be diagnosed as diabetic. And the pre-diabetic stage, we consider them from 100 to 125. And then we want the normal person to be below 100 if they're fasting and haven't had anything. And this just shows the last 24 hours, not 3 months. But that's another very good testing that they use. Now, when we look at the oral glucose tolerance test, this was the first kind of ever when they first started diagnosing diabetes and what they use in this. It's more difficult and it's time consuming because before they used to give them like a Coke can to drink, and it has so many amount of sugar, and they would test their blood 1 hour and 2 hours after that, or even 3 hours, and see what happens after they drink that. So they would do two different tests and measure what their glucose is based on how much the insulin kind of got to work and lower that insulin down. So yeah, so this also has a little bit higher category. They're looking at 200 or above is diabetic, and then 140 to 199 is kind of pre-diabetic. So it's below 139 is kind of normal, it's called OGTT or glucose tolerance test, but mainly what we focus now today is A1C. So these are the numbers just to let you know, guys. All right, next. Now this is what we mainly focus on. We want the patients to prevent the risk factors, and this is what the patients can actually do. So what are the actions that patients can do to prevent diabetes? There's risk factors. We're going to talk right now about the uncontrollable and the controllable risk factors. So there's many risk factors that we're going to talk about. The uncontrollable risk factors include three main things. So if you have a family history, that's not something you can control. You can't get rid of your family. It's just genetics, right? So that's the genetic part. So that's something, if you have a family member that has a risk factor, has diabetes, then that puts you at a more high risk of having that. The second thing is certain racial and ethnic groups are more risk at having than others. It's more common in African American, Hispanic Latinos, and Native Americans, as well as Asian Americans and Pacific Islanders. These just have a tendency to have more a tendency of diabetes more. The third thing that you cannot control is your age. You know, until they invent a time machine, we're stuck with whatever we got, right? So age is, as you get older, your body becomes less sensitive to insulin, so it doesn't use it as well. Being 45 and older increases your risk just a little bit. So it's important when you start to get to that age and going over, it's more important to work on the controllable risk factors. And that's what we're going to talk about right now. So what are the controllable risk factors that you can do today to prevent that? The first thing is being overweight or obese. I went to so many conferences, and what they say is, like, once you lose your belly, you're at a lower risk of having that diabetes. So it's all about losing that weight. Being overweight or obese, so for example, is your waist over 35 inches for women, or is it over 40 inches for men? The more body fat you have, especially around your tummy, the harder it is for your cells to use insulin. So that's the first kind of risk factor. The second risk factor that you can control is not being active. So exercise makes you more sensitive to insulin. So you're better able to convert that glucose into energy the more you exercise. So we kind of encourage a lot of patients to be more active, go out there, run, walk, do whatever exercise you can do at your limitation. Ride a bike, go on the beach, go on the pool, and do all that more exercise stuff. The third thing we like is other medical conditions that you can control. If you have other medical conditions, kind of including high blood pressure, low HDL, low high density lipoprotein, high triglycerides, all those you can prevent them by controlling them, and these will make you at lower risk of having that. So if you have any of these risk factors and you haven't been screened or tested for diabetes, talk to your doctor, come see us, and we're more than happy to see what's going on. Yeah. So preventing diabetes, it's not an easy thing. If you have diabetes, or if you're diagnosed with pre-diabetic, or have some kind of risk factors we just discussed, please know there are steps that you can take every day to work towards improving your health. So be encouraged that small steps can make a big difference. There are lifestyle changes that can help delay or prevent the onset of type 2 diabetes. So let's take a closer look at what can we do, or what can be done to improve those health. So first, make good choices. Eat more of what and eat less of what. So what do we recommend eating, and what do we try to prevent you from eating? So what we usually say is, it's kind of like rhyming. 3 things that are not nice: bread, pasta, and rice. We usually say that to all our patients. The reason why bread, pasta, and rice, these are the 3 main sources for carbs. So we try to limit them. We don't cut them off completely, because you need some kind of carbs in your body. But those who are mainly having their food around those carbs, we're going to talk about that. You want to eat less of that. But let's go into the detail exactly here. eating healthy is one way to help prevent diabetes. According to the American Diabetes Association, they say healthy eating focuses on wholesome of foods such as fruits, vegetables are the main two things. So you want to increase those. Those should constitute half of your plate every time. So fruits and vegetables should be half of what you're eating in every single meal if you want to prevent that to be whole grains. And also lean meats is a great start. Those are where you want to put your protein into. So kind of like lean meats and the healthy meat is also. So remember that food is fuel for your body, and in order to function at its best, you want to feed it the best quality of food that you can put in there. So fill your plate with all the vegetables, the fruits, high in fiber, and make sure you eat less of the processed foods. So you want to prevent eating a lot of sweets, snack foods, and chips. This is very common in all of us that when we're watching a movie, you just want to pop that popcorn or get the bag of chips, and hey, there's a deal. We're going to get a larger size of chips. So we always try to, no, it's not really a good deal. It's more of a bad deal for your body. But the bottom line is we want to, simple sugars provide very little nutritional value in terms of your body's energy. And they raise your blood glucose sugar very fast, very rapidly. And that's what kind of examples of simple sugars is like, just like we say here, table sugar, soda, drinking a lot of soda and Cokes, and even Diet Cokes, by the way, fruit juice, all those, and candy, all that is, we try to limit it as much as we can. So remember, just anything new, healthful eating will take some time to get used to, but stick with it. Yeah, I'll tell you a quick story here really quick. I had a patient that was like, cannot stop eating his sugar and his snacks and his cookies. And every night he tells me, I can't. And he puts so much sugar in his coffee. So we decided on taking it one step at a time. And I told him in a month, the first month, you're going to have to suffer, because you're not going to like the taste of your coffee. You're not going to like the taste of your food. You're not going to like it. It's going to be annoying. But I just want you to be strong enough to just go over this month. It's just a hump. Once we pass this month, then your taste buds are going to okay, I'm getting used to it. All right, I get it. I get it. But if you still want that caffeine, if you still want that, some kind of alternative of smoothies, we're substituting bread, carbs, and carbs with smoothies in the morning as a breakfast, and instead of that big loaf of bread and everything. And he did. After a month, we noticed not only did he decrease about 9 pounds or 10 pounds, but his taste buds now is also getting used to this. And now when he's calling, he's like, okay, I think I'm not used to I don't like putting sugar anymore as much as I used to. And then we cut it down even further more. So instead of 4 spoons, he's using 2 spoons, and now we're using 1 spoon, and then we're going to slowly cut them off. But it's not overnight. I'm just gonna let you know, it's not overnight, and diabetes does not happen overnight. Their complication also all prevents over time. So sorry for that story, but yeah. Let's go next. So now here, this is what we're going to talk about: the simple and complex carbs, and this is the main thing that we're talking about. Which types of carbs or carbohydrates are better choice for keeping your blood sugar levels in healthy range? So it's important to understand the difference between the complex and not complex, and this is based on National Library of Medicine's page. They have actually a classification of how to determine which one is which. So simple carbs are basically sugar. They give you a quick energy because they're absorbed quickly, but that means they can change your blood sugar quickly. Most simple carbs are low in nutrients and fiber, so they're absorbed quickly, which is good to change your blood sugar. Some examples of food that are simple for carbs, like we just talked about: sodas, candies, white rice, white bread, and pasta. Remember the 3 things that are not nice? That comes under simple sugar. What they do is they spike your blood glucose with very rapidly. So complex carbs, on the other hand, are sort of opposite. What happens is they digest slowly. They keep the blood sugar more stable than simple carbs. So there's not that spike that we usually see in the blood sugar after you have that meal. And they're often rich in fiber, so they're more satisfying and more health promoting. because complex carbs often come from whole plant foods, they're also often high in vitamins and minerals, so here are some typical, so what are the examples of those, right? So green vegetables, they have carbs, but they're complex carbs. Whole grains and foods that are made from them, such as oatmeal, right? We recommend patients to have, if you want to have carbs, go for oatmeal in the morning. That's a good breakfast. What that does is that doesn't spike your glucose really quick, but it kind of gives you that steady, long-term, good energy in your body. So if you want to take some kind of bread, we also recommend the whole grain breads. Starchy vegetables, such as potatoes, sweet potatoes is also another alternative. Corn and pumpkin, just beans, lentils, peas, all these other, small kind of, these are very good. So those are the types of complex carbs that we recommend. Yes, let's go. Yes, go ahead, Jennifer.
We had one question in the chat box about what about whole grain pasta?
Anything whole grain, whatever is made out of whole grain is better than, so if you have to stick to pasta, go for whole grains. I would recommend going to whole grains than the white grain, yeah. They also have a longer term of complex carbs versus simple carbs. Good question. Awesome, so so after we talked about all the nutritional value, how to stay healthy, about eating, what you put in, is what your energy, what you're fueling your body. The next thing is exercising and keeping healthy and keep moving. So exercising can help keep your blood sugar levels more stable. The reason why we said it earlier is that the more active you are, the more energetic and like more exercise you do, your body now absorbs more of that glucose. So what it does is it gets it out of the bloodstream, and you don't have that high glucose in your blood. So according to American Diabetes Association page, they have a page of physical activity. They're talking about exercise as a super way to prevent diabetes because it uses that extra glucose in the bloodstream to refuel those energy that you're needing to burn during those exercise. It helps control your body weight. So it also decreases that extra fat that you might have, that kind of, we want to reduce it or take it down to prevent that diabetes. It also helps control other chronic conditions. Remember when we said one of the 3 controllable things are chronic conditions, like high blood pressure, high cholesterol, all these conditions actually could be managed as well by that one exercise. So that 30 minutes of walk every day, that walking on the beach or going in the pool, or maybe even doing cardio in your home by yourself, all that. Exercises as well, what it does is improve circulation throughout your body, which help your body to use insulin better. So it's kind of like a pump. Your heart is a pump. It's kind of pumping that insulin all over your body to help utilize it more. The third thing is it reduces the stress. So exercise also, when you exercise, when you come back home, you're like, stress-free, you're getting all the things out of your head. You're like, I'm more energetic, and that kind of another additional program. Last thing, it strengthens your muscles, your heart, your bone. So all that exercises, those are the main benefits of what American Diabetes Association say about exercising. So make sure you consult your doctor on what exercises is safe for you, or what exercise is appropriate for you, because every patient is different. It's different from someone who had a recent hip fracture that had a surgery. We recommend different exercises for someone that had an arthritis on his knee that cannot do heavy exercises, based on their BMI, based on their activity level, based on their heart conditions. What can we advise the patients for appropriate exercises that they can do? So be sure to start slow and build up. Same like we talked about eating. You always want to start slow. If it's 20 minutes a day for three times a week, and then we built it up to 30 minutes a day for 3 times a week, then we increase the amount of time to 4 times a week. So there's a stepwise approach that we follow even in exercising to get to that level. We're not going to aim for a 6-pack next month. We're not going to aim for, hey, I want you to be athletic. I want you to run, this many miles a day. It's all about stepwise approach and how to get there. Yeah. So thank you. Yeah. I believe there's someone on the phone. If you could mute yourself, once in a while, I think we hear some background noise. So we're almost done here, actually. We're good. Last 2 slides, we have maintain your healthy weight. So if you eat less calories and fats, we're going to talk about how to be active most of the days, eating breakfast every day, and keeping records. And we're going to talk about how American Diabetes Association have a page in terms of overweight. Being overweight raises your risk of diabetes, as well as your heart disease, stroke, and high blood pressure. But the good news is that if you're overweight, even losing modest amount of weight, like 10 or 15 pounds, can help prevent or control many health conditions very significantly. So that small increase in weight, whatever you do, helps out a lot. So don't think, oh, it's really hard, I can't do it. Oh, even if I lose, it's not gonna do anything. It does improve, and studies have been shown to prove that. So losing weight doesn't have to be complicated. Talk to your doctor about losing weight program. The American Diabetes Association recommends the following strategies to lose weight. Eat less calories and fat. Second thing, be active most days of the week, whenever you can. Eat breakfast every day. So have your breakfast as your main meal. Don't have your dinner as your main meal. People eat the dinner the biggest and breakfast the smallest. So American Diabetes Association trying to flip that. Make your breakfast like a king's breakfast, and make your dinner like a poor man's dinner that doesn't have anything to eat, or a very small amount, or minute. That way your body, when you're sleeping, you're not kind of storing all that as your fat. And then the fourth thing is keep records of your weight and daily eating and exercise habits. So there's a table. There's actually a table that there's a sample that American Diabetes have. There's all these programs they have that it's like a printout that patients could log. It's like a log journey that they could log in what they ate, breakfast, lunch, and dinner, and if there's any snacks in between. And then there's another column where they put what did they, how much exercise did they do that day? 30 minutes, 20 minutes, or what type of exercise. And then another one that they measure their weight. So they put in their daily weight in there as well. So they step on this scale, they measure it. And what we're starting actually in primary care, and this is something that's going nationwide, is something called remote patient monitoring. And we're very heavily involved in that. Remote patient monitoring is where we actually ship now with COVID and everything. We're shipping patients devices like blood pressure, blood glucose monitor for diabetes, and also a weight scale. So the patients get it at their home, and once they step on that weight, they measure their glucose. It transmits that data to us in our clinic, so we can see it as doctors, and we can see what's happening with the patients every single day. And it kind of creates that log for us. So it gives us a graph on where the patient is every single day. Have they lost weight? Have they increased weight? What's their glucose? And it alerts us if anyone has a higher normal results. But that's something we're doing in the community to keep them healthy and happy, and kind of log that. So that's another kind of like active approach instead of a log. Awesome. So I think we're at the end here. Thank you for surviving so far. So let's talk about this 30 minutes. So let's review actually what we talked about today. So at the end of today's session, with a quick review, diabetes is a common but serious condition in which the body does not properly process the food for use as energy. As a result, the body cells can't let the glucose in, so the glucose builds up in the blood, causing a high blood sugar. Prediabetes is what we're talking about this month, which is November, right? Diabetes prevention is when a person's blood sugar level is higher than the normal, or it's above that level that we talked about earlier, but not high enough to constitute for a diagnosis of diabetes. So it's right before that cutoff line, but higher than the normal in that range. That puts the person at a greater risk of developing type 2 diabetes. So you can prevent it. In fact, there's a few steps we talked about. We're talking how can you lower that glucose level. That includes healthy diet and what you eat. The second thing we talked about is active and being active most of the days during the week. And third is maintaining your healthy body weight. So those are the 3 most common things you want to take home. Just make sure you eat healthy, you actively involved in exercising, and you kind of keep that weight within normal. So what is that one thing you learned today that surprised you? I want to hear that in the chat, and also tell us guys right now. And what is that one change plan that you want to make today? You want to start today, like let's just say November 18th today or 19th today. What are we going to do today going forward on our everyday plan based on what you learned today? What is that action that you're going to take today? And what is that commitment you're going to put in to keep healthy and stay healthy? And thank you very much. Yeah, these are the references, by the way. We'll copy and put it in the chat if anyone wants it. Questions, guys? Thank you.
I actually have one that I put out there. My father's a type 2 diabetic, and every so often his blood sugar will drop, and he'll get sweaty and shaky and all that. What's the best thing for somebody to eat at that point to try and get their sugar up without being too quick, where then they crash again? Because he's very fond of cookies. You understand.
Absolutely, my dad is the same. So what happened there in that case was a hypoglycemic attack. So a patient usually have a low glucose when it drops below 50 or it drops below 60. We usually cut off at 50 and it's below, then they start having those shivering. They might have sweating. They might even lose consciousness, right? Some patients might be like normal and they'll like sit down like faint at sudden. So what we usually give them is a sublingual. We usually give they can get something under the tongue, or they can put some honey or any kind of sweet or candy. Those things that we said we don't recommend. Those are things that spike your sugar really quick. That's what we want to achieve. And if we give them a little bit of that, just to spike it up a little bit, just get it back to normal, we're not worried about making it to 300 or 400, the sugar level. So it's not something to be afraid of that much. We're not going to get it to the high normal. We just wanted to get it back to normal as fast as we can, so that under the tongue, honey, candy, sweet, anything. Sometimes we recommend even diabetic patients who have their diabetes is uncontrolled. We always recommend them to have something in their pocket as a candy or something, just in case if they're even feeling a little bit of shivering, shaking, sweaty, before that unconscious happens. We recommend that they get that in their pocket. And sometimes we have patients fainting. So even if they have something in their pocket, first aiders or first responders, they usually look if they have a bracelet of a diabetic. Some patients might have a bracelet that says I'm diabetic. So they would look in their pockets and put something in their mouth if they're unconscious, and that kind of helps them as well. I don't know if that answers the question. Emily put all the references here for you guys. That's amazing. Thank you.
I'm kind of curious. Emily also said she was going to start tracking food and exercise, I think, in the chat, which is one of the things that the diabetes prevention program highly recommends, that you're going to be much more likely to be successful if you're tracking your food intake, you're aware of some of your eating patterns, and you're tracking your physical activity. So I'm curious. I love the idea of remote patient monitoring. I think that gives a lot more conversation around that, and it's definitely encouraging to patients to know that they have that conversation going with their physician. I think that's great. Would love to know what people are doing to track right now, or if they're tracking on the call. If you all talk at one time, we're not gonna be able to hear you. That's a joke, haha. Do you need me to unmute you? I'm gonna unmute you guys.
I do the walker tracker, and I walk an hour a day, a power walk an hour a day at least. My eating isn't great. I eat less of the bad stuff, but I still eat some of it, a lot of it. And I need to do better.
Do you use any gadgets or anything to track food at this point, or do you just track your physical activity?
Just the physical activity. I know what I'm eating when I'm eating the wrong stuff. I just still eat it. I am wondering about, would it be advantageous to get one of those blood glucose things and test it on myself every day? I do have an appointment in a month to go back and have my doctor check my statistics, but I was just wondering if there's something I can do in the meantime.
That's a very good question. So we do recommend like, so it depends if you're type 1 diabetic. We usually recommend everyone to have the diabetic glucose testing that they could, either poke their finger, or now there's like stickers on their hand and other things that you can measure. Type 2 diabetic also as well, based on if they're controlled or uncontrolled. We usually recommend having that and then measuring it once a day, usually. And then we do it usually before meal and after meal, and we kind of see where you're at in their glucose. And then either that machines nowadays, they have where they save all the numbers, or you can bring it to your doctor and the doctor could just take a look at it, glance through it, pass through all the dates and see whenever there's a spike or one time, or is it a regular spike, or what we try to tend to look for is there a certain part of the day that we notice that your glucose is always high? What part of the day is that? Then we know, okay, the medication that I'm giving you is not covering these hours, or it's not covering these times. And then we take a step back and we look at what medications are you taking currently and what can we adjust? Do we need to change the medication? Do we need to change the dosage? Do we need to change the duration of when you're taking that medication? So that's going to give us an idea of how can we control your glucose throughout all 24 hours of the day.
Okay.
So that's the reason why we kind of like, we usually recommend it. So, but go to your doctor and ask your doctor, what do you recommend for me to monitor, and how often do you want me to do that?
Right. I would rather not go on medicine, so I'm trying to avoid that if I can.
Absolutely. Diet and exercise is the #1 treatment that we even start all patients on before putting them on a single pill. Because the first line of therapy of any diabetic patients, or even prediabetes, is controlling on diet and exercise. And if we can, we want to eliminate as much medication as we can. With the side effects, with all the medications, I mean, it's not something we like to give every patient. We usually recommend we try to push them as much as we can with diet and exercise first. And only then, if that doesn't work, then we might need to add medication. So you're doing great if you're not taking any medications, and keep it that way. I love that 1 hour power walk. That's amazing. When I hear that, it's like music in my ear.
So I should just not go ahead and get the blood tracker right now, just wait and talk to the doctor. I have an appointment in a month.
Well, you can always call, you can always call your doctor and in their office instead of waiting for a month, and just see what they say, what they recommend. They could do a televisit. They could put you in for an urgent televisit now with COVID. They're doing a lot of telephones and video chats and see what they recommend until then. But you know what? Keep that exercise and diet going. That's the most important thing.
Now, one more thing. I do have high cholesterol. Is that affecting the sugar numbers?
Very good question. So cholesterol is related to diabetes indirectly, and blood pressure. So blood pressure and cholesterol, they all contribute to having a higher glucose level. And if you look at it the other way, one of the complications of diabetes is hyperlipidemia. So it could be they do correlate together in a way. Indirectly, though, it's too much pathophysiology mechanics in there. But yes, I would recommend controlling as much as you can with your LDL, keeping it low, keeping your HDL, your high density lipoprotein, as much as possible above 50, and your cholesterol. Try to keep that down as much as possible. If you're eating, a lot of oil, a lot of fat stuff, fatty food, you want to decrease that. Nowadays, I think they have this, Christmas is coming, everyone's giving this, what is that? Air instead of oil.
Oh, air fryer.
Air fryer. Right. This is a common trend now. It's going on. Air fryer is highly recommended. You only put a little bit of oil. Air just, fries everything. That also, we recommend that to every patient who has a high cholesterol. It's a cool kind of like device, but it actually keeps that healthy nutrition in you.
What about virgin olive oil? I use a lot of that.
Olive oil is good. Olive oil is good, but also in moderation. Again, we're trying to keep the saturated and unsaturated fat in moderation. Olive oil is good.
Okay, thank you.
No, thank you. Very, very good questions. I love it. Thank you very much.
When you talk about the remote monitoring, do you have specific technology that you use to do that with patients?
Very good question. Yes. So we started this remote patient monitoring about a year ago, a little bit over. And what we're doing is there's certain devices that we ship to patients, and these devices have a certain technology in it where, because elderly patients, we're trying to avoid them from struggling with their phones and their IT and their Bluetooth and setting up a new account and downloading an app and all this hectic stuff. So we found a way that now we're using devices that have SIM card in it. So we're putting a SIM card in it. We're pre-populating that device with the patient's information. So once we ship it to the patient's home, they just open that box, they step on the weight or they measure their glucose, and it actually automatically transmits it to us with their name and number, and it puts it under, we see everything what's going on. So the doctor is always seeing it. There's always someone on top of their shoulder to make sure that they're taken care of, and if anything comes out of the normal.
Great idea. What's the name of the device? Do you remember?
All
right.
No, so it's not a particular device. So
it's not.
yeah, it's not a particular device. It's more of the whole system that comes together. So there's different devices, but it's the device that synchronizes with the platform, and this platform synchronizes with our electronic medical record. So the doctors could see it right away. So there's a lot of components into it, and the most important component is the nursing side, where they call the patients every month to make sure that they're doing okay, and keep on top of them and provide them with this diabetes patient. But yeah, I don't know on top of my head.
Highlight that more. That's phenomenal. Yeah.
Well, today it's prediabetes. We're talking about diabetes, so that's one input, one part of what we're doing in primary care, and then we're starting to implement that. And we're very excited and happy to.
Smarter, not harder is very important. Yes.
Okay.
Any other questions? I don't see anything in the chat box. No?
I use Weight Watchers to track food and use Apple Watch to track activity. Love it. Apple Watch. I got myself one just after all this activity. It measures how much, and there's goals you can set up on how much you run, how much you try to do this. Love that. Using of technology in today's world with what we didn't have 20 years ago, today is so much innovative that we can use in our medicine. And so I love that. Weight Watchers to track food. Amazing. That's good. I love it. Yeah, that's great job, Catherine. Thank you so much for sharing.
Yeah, we've been talking about that on our calls with the National Diabetes Prevention Program this week too. And it would be nice if we could put together an extensive list of different platforms. We talked about MyFitnessPal this week. That's a free platform that you can track your food and your exercise on there as well. A lot of your smartphones come with some technology to track your steps. The Walker Tracker platform that some of you all you use right now allows you to not only sync with your phone for steps, but you can manually go in there and sync your activity or manually input for 100 different activities and then have those steps counted to our challenge as well. So a lot of free resources out there to track if you don't want to track manually on a log every day. And a lot of times that takes a lot of the guesswork out of how many calories are actually there, and it's easy to track. I know MyFitnessPal gets used to our rhythms and patterns of what we eat every week, so those foods come up easy for you to track. Great idea I had this week too. We talk about how do you get through, or how do you not forget to track your meals. Somebody was like, well, take a picture of your meal and then go back and track it later. I was like, that's a great recommendation. So we're hoping to also send out, different social media pieces and things from this. They had great recommendations for a lot of challenges and barriers to tracking food, to remembering to eat healthy, and how to get extra activity in each day, that we can start sending out some of those social media messages as well too, and really start building that up, because there is a lot of ways to, I liked it sneak it in or fit it in, that you don't think about, and breaking some of those physical activity goals into smaller chunks through the day to get that in too. So anybody else? I see two more maybe. Excellent presentation. Yes, that was a great presentation, Dr. Bizanti. It was great. A lot of good information. So as I mentioned earlier, we are working on a diabetes prevention program and maybe multiple sites as we're trying to grow this year of the National Diabetes Prevention Program. It is a long program, but we are trying to make changes in people's lifestyles, and those changes take time to make. And as they keep telling us, the change doesn't just happen with that 1 hour class that week. It's what happens outside of the class while people are practicing some of those new skills and things that are really important, but being able to come back the next week and share some of those challenges and maybe get some more coping skills for that too. So, and learning from the group and what everybody's learning as well. So we're really hoping to get those initiated and then eventually become a CDC recognized site for that as well. And then diabetes self-management as well. So we'll keep you informed on that. And as we move and what those classes are going to look like, we're still working on getting training and getting out where we're going to start our first classes and move from there. But I did want to let you know that our next presentation with the Art of Healthy Living, the next webinar, is on December 3rd. And that's battling dangerous belly fat with Humana. So we hope you join us there and that you share these presentations with others. Friends, family, coworkers, and invite them to join us for these presentations. And then our last webinar coming up this year, which is kind of sad. This has been a lot of fun having these webinars. So we might have to look into the coming year on what we can focus in on for the coming year. But living healthy to 100. And I had to look a little forward on this presentation because we're really excited about some of the pieces in here. You know, we've been looking at Healthy St. Lucie on what it would be like to have like a Blue Zones project going in our community and looking at how can we live longer, but virtually with chronic disease free. So I think that's like the ultimate vision of some of those pieces. And some of those pieces are going to be covered in Living to 100. And we've been kind of doing some crosswalk between what do the Blue Zones communities that are starting around the US right now look like compared to what we're doing right now in Healthy St. Lucie, and kind of seeing where some of those gaps are and how we might be able to fill those to work with restaurants, grocery stores, work sites, and kind of creating an environment where just where we live helps create healthy lifestyles, not just the choices we make every day. So making those environmental and policy changes that can really help us be healthier. So hope you all will join us for these next 2 sessions. And if you are not on our mailing list for Healthy St. Lucie and want to get more information about that, here's some contact information, or you can send it in the chat box right now. But anything else before we conclude our webinar today?
You said you were recording this. Is there any way to go back to other ones? I missed the one about ditching processed foods. Is there some way I can see that?
Yes, I will send you a link. That was Colleen?
No, this is Julie.
Julie, sorry. Julie, yes, I can send you links to that for sure.
Okay, that would be great.
We do have a Healthy St. Lucie YouTube channel where you can find some of that information as well.
Oh, okay.
So we can send out a link to all of those too. Yeah.
Perfect. Thank you.
Great. Anything else?
Thank you, Dr. B. Awesome as always.
All right. Thank you all so much for coming, and we hope to see you December 3rd for battling dangerous belly fat.
Thank you.
Have a good week.